In my mind, unnecessary drama is hemorrhaging with both members of the party from that experience when it could have just been prevented. This person is arguing that we misdiagnosed placenta previas at 20 weeks and that all it leads to is unnecessary drama. So placenta previa is when your placenta covers your cervical os, and this is obviously a problem during childbirth because a baby has to come through there. And so we most often diagnose this around 20 weeks when you have your anatomy ultrasound. Once we have this information about your placenta previa, we're going to recommend pelvic rest. We don't want anything near that cervix that's going to cause bleeding. So that means that I, as an OBGYN, am not going to do digital exams, and you, as a patient, are going to keep everything away from your cervix. And while it is true that about 90% of those placenta previas will move away, there are going to be 10% where it stays covering the cervical os. And for those patients, we're going to recommend a C-section. Now, I'm going to give this person the benefit of the doubt and assume that they're not actually advocating for worse outcomes, but they just don't understand exactly what this condition is and what can be done to prevent the really bad things from happening. In my mind, it is not unnecessary to give patients information about their own pregnancies. It's not drama. It's not unnecessary anxiety. It's information. It's not helpful to just bury your head in the sand and assume it's not happening. That's not going to be helpful to you in your pregnancy. Knowledge is power, and with that power comes the option of making a safe choice for you and your pregnancy.